Using baking soda this way will ruin your health. 5 expert tips for safe and effective use. Introduction. Baking soda, also known as sodium bicarbonate, is one of the most versatile and commonly used household ingredients. Its uses range from cleaning to personal care and even natural remedies. However, despite its many benefits, improper use of baking soda can lead to serious health issues. In this article, we will explore 12 of the most common mistakes made when using baking soda, backed by scientific research and expert opinions, and provide you with the knowledge to use this ingredient safely. 1. Using baking soda for acid reflux without consulting a doctor. Acid reflux is a condition where stomach acid flows back into the esophagus, causing discomfort and potential long-term damage. Some people use baking soda as an immediate solution to neutralize stomach acid. While this can temporarily relieve symptoms, it's not a recommended long-term strategy. Baking soda, when consumed in excess, can worsen symptoms by altering your body's pH levels and creating a dependency on antacids. Scientific research indicates that excessive use of baking soda can lead to metabolic alkalosis, a condition where the blood becomes too alkaline, disrupting normal cellular function and possibly leading to kidney issues. Therefore, it's essential to consult a healthcare provider before relying on baking soda for acid reflux relief. 2. Using baking soda for heartburn frequently. Many people turn to baking soda to alleviate heartburn, thinking that its alkaline nature will neutralize stomach acids and provide relief. However, using baking soda too often can cause your body to become reliant on it, leading to a vicious cycle. Over time, this can lead to higher blood pressure, kidney strain, and metabolic imbalances. 3. Applying baking soda directly on skin without dilution. Baking soda is commonly used in personal care products, such as scrubs, deodorants, and facial treatments. However, undiluted baking soda can irritate the skin, leading to dryness, rashes, and in some cases, chemical burns. The pH of baking soda is alkaline, and using it undiluted can disrupt the skin's natural acid mantle, causing it to lose moisture and become more susceptible to environmental damage. Scientific studies show that prolonged use of undiluted baking soda on the skin can increase the risk of skin infections, especially for individuals with sensitive skin. Always dilute baking soda with water before applying it to your skin, and do a patch test to ensure you don't have an adverse reaction. 4. Using baking soda to whiten teeth without caution. While baking soda is effective at removing surface stains from teeth due to its mild abrasive nature, overuse can erode enamel. The abrasive particles can scrub away the enamel, leading to tooth sensitivity and an increased risk of cavities. Studies have shown that prolonged use of abrasive substances like baking soda can harm dental health, particularly in older adults who may already have weaker enamel. 5. Overusing baking soda in bath water. Epsom salt and baking soda are often used in baths to relieve sore muscles and promote relaxation. However, using too much baking soda in the bath can lead to skin irritation and disrupt the body's natural pH balance. High doses of baking soda in water can be absorbed by the skin, affecting kidney function and possibly causing an electrolyte imbalance. 6. Using baking soda as a cleaning agent in a poorly ventilated space. Baking soda is a popular cleaning agent, but using it in confined, poorly ventilated spaces can cause respiratory irritation. Inhaling baking soda dust or fumes in large quantities can lead to irritation of the respiratory system, causing symptoms such as coughing, wheezing, and shortness of breath. Prolonged exposure may aggravate pre-existing conditions like asthma. 7. Using baking soda in high quantities for kidney health. While there's evidence that baking soda may help manage kidney function in individuals with chronic kidney disease, CKD, it must be done under medical supervision. In high doses, baking soda can cause an electrolyte imbalance, leading to complications such as metabolic alkalosis, increased sodium levels, and possible kidney damage. Research indicates that individuals with CKD must be cautious about using baking soda as a remedy. 8. Not measuring the dosage correctly. Baking soda is often used as a natural remedy for a variety of conditions, but improper dosage can lead to severe consequences. As mentioned earlier, excessive use of baking soda can lead to metabolic alkalosis, a dangerous condition where the body's pH becomes too high. It's important to follow recommended dosages carefully and never exceed the advised amounts. 9. Ignoring the risks of high sodium levels. Baking soda contains a high amount of sodium. Regular consumption of too much baking soda can lead to elevated sodium levels, which increases the risk of high blood pressure, heart disease, and stroke. For seniors, particularly those with pre-existing heart conditions, it's essential to monitor sodium intake and avoid using excessive amounts of baking soda regularly. 10. Using baking soda as a remedy for stomach ulcers. While baking soda may temporarily neutralize stomach acid, it is not a suitable long-term remedy for stomach ulcers. Studies indicate that excessive use of baking soda can increase stomach acid production over time, exacerbating ulcers, and causing further damage to the stomach lining. If you suffer from ulcers, it's best to consult with a healthcare provider for appropriate treatment. 11. Using baking soda to detox without medical supervision. Many people use baking soda in detox regimens, believing that it can help cleanse the body of toxins. While baking soda may aid in maintaining the body's pH balance, there's little scientific evidence to support the claim that it can detoxify the body. Overuse of baking soda in detox programs can lead to dehydration, electrolyte imbalances, and gastrointestinal discomfort. 12. Failing to consult a doctor before use. One of the biggest mistakes people make when using baking soda is failing to consult a healthcare provider before starting a regimen, especially for individuals with chronic conditions such as kidney disease, hypertension, or diabetes. While baking soda is generally safe in small doses, it can interact with medications and exacerbate existing health issues. 5. Expert-backed tips for using baking soda safely. 1. Dilute properly. Baking soda, or sodium bicarbonate, is a powerful compound with many applications, from personal care to household cleaning. However, as with any potent substance, it's important to use it in moderation and with care. Dilution is one of the most important steps when using baking soda for health-related purposes, whether it's for digestion, skincare, or as a cleaning agent. Why dilution matters. Baking soda has an alkaline pH of around 9, which is higher than that of your skin, which typically ranges from 4.5 to 5.5. If used undiluted, baking soda can disrupt the skin's natural acidic barrier, leading to irritation, dryness, and in some cases, chemical burns. This is especially true for individuals with sensitive skin, such as seniors or those with conditions like eczema or rosacea. The same principle applies when it is used for digestive issues, as undiluted baking soda can irritate the stomach lining. How to dilute baking soda? For skin use, if you're using baking soda in a homemade facial scrub or bath soak, always mix it with water to create a gentle paste or solution. Start with a small amount of baking soda, around half a teaspoon, and mix it with 1 to 2 tablespoons of water. This diluted mixture can help exfoliate without causing irritation. For digestive issues, when using baking soda to relieve heartburn or indigestion, dissolve 1/2 teaspoon of baking soda in at least 8 ounces, about 240 milliliters, of water. This dilution helps to neutralize stomach acids effectively without overwhelming the digestive system. For household cleaning, if you are using baking soda as a cleaning agent for your skin or around your home, it's important to make a paste with water or dilute it further with a cleaning solution, depending on the surface you are cleaning. Research insight. A study published in the Journal of the American Academy of Dermatology explored the effects of undiluted alkaline solutions on the skin. The researchers found that when highly alkaline substances like baking soda were applied directly to the skin without dilution, they significantly impaired the skin's ability to maintain its natural barrier, which could lead to dryness and irritation over time. Always dilute baking soda before applying it to your skin to ensure safety. To limit usage. Although baking soda is an effective natural remedy, it's important to use it sparingly. Overusing baking soda, particularly in digestive and skincare routines, can lead to a range of health issues, including electrolyte imbalances, digestive disturbances, and skin damage. Why you should limit baking soda? For digestive health, while baking soda may provide short-term relief from heartburn or indigestion, it should not be relied upon as a long-term solution. Overuse can disrupt the body's natural acid-base balance, potentially leading to metabolic alkalosis, a condition where the blood becomes too alkaline. In the long term, this can interfere with digestion and absorption of nutrients. For skin health, excessive use of baking soda on the skin can lead to overdrying and irritation. It can strip the skin of its natural oils, leading to redness, itchiness, and compromised skin integrity, especially for older adults whose skin may already be thinner and more sensitive. For oral health, although baking soda is commonly used as a teeth whitening agent, its abrasive properties can wear down enamel if used too frequently. Experts recommend limiting the use of baking soda for oral hygiene to avoid enamel erosion and tooth sensitivity. How to limit usage. For digestive relief, use baking soda for digestive discomfort no more than once or twice a week. Rely on more sustainable and healthier remedies, such as dietary changes or antacids, as advised by your doctor. For skin use, limit the use of baking soda as a scrub to once or twice a week. Opt for gentler alternatives, like oatmeal or honey, for regular skincare routines. When used as a face mask or scrub, keep the application time short, about 5 to 10 minutes, and always moisturize afterward. For oral care, when using baking soda to whiten teeth, use it only once or twice a week in combination with your regular toothpaste. Avoid scrubbing too hard, as this can increase the risk of enamel damage. Research insight. A 2016 study in the Journal of Clinical Gastroenterology highlighted the risks of prolonged use of sodium bicarbonate for acid reflux and heartburn relief. The study found that while sodium bicarbonate could provide immediate relief, Frequent use can lead to a disruption in the body's acid-base balance, causing more harm than good in the long term. 3. Monitor sodium intake. Baking soda contains a significant amount of sodium. In fact, 1/2 teaspoon of baking soda contains about 1,259 milligrams of sodium. For individuals with high blood pressure, kidney issues, or heart conditions, excessive sodium intake can exacerbate these health problems. Why monitoring sodium intake is crucial. Excessive sodium intake is one of the leading causes of hypertension, high blood pressure, and cardiovascular disease. When baking soda is consumed in large amounts, it can increase sodium levels in the body, contributing to fluid retention, increased blood pressure, and a higher risk of heart attack or stroke. The elderly, who may already be at risk for these conditions, need to be particularly cautious. How to monitor sodium intake. For digestive use, always follow recommended dosages. For heartburn, use only 1/2 teaspoon of baking soda per 8 ounces of water. Limit usage to no more than once or twice a week. For general health, if you are on a sodium-restricted diet, consult with your doctor before using baking soda regularly. You may need to avoid it altogether or substitute it with other alternatives, like magnesium-based antacids, which are lower in sodium. Research insight. A 2017 study in the American Journal of Clinical Nutrition examined the effects of high-sodium diets on individuals with hypertension and found that excessive sodium intake, even in small amounts, significantly raised blood pressure. The study also pointed out that regular consumption of high-sodium foods or remedies, like baking soda, can contribute to chronic health issues, especially for individuals already at risk. 4. Use baking soda for short-term relief only. Baking soda should be seen as a temporary remedy for conditions like heartburn, indigestion, or sore muscles. It should not be relied upon for chronic conditions without seeking professional medical advice. For those with long-term or recurring health issues, baking soda may provide short-term relief but will not address the underlying causes of the symptoms. Why short-term use is essential. Baking soda temporarily neutralizes stomach acid, but it does not address the root cause of issues like acid reflux, bloating, or indigestion. Overusing it can mask symptoms without providing a real solution. For chronic conditions such as gastroesophageal reflux disease, GERD, or muscle pain, it's crucial to consult with a healthcare provider for a comprehensive treatment plan. How to use baking soda for short-term relief. For heartburn, use baking soda only as needed for occasional heartburn relief. Limit use to once or twice a week to avoid dependency. For muscle soreness, if you experience muscle soreness after a workout, you can use baking soda in a bath or in a warm compress to temporarily relieve the discomfort. However, consider other recovery strategies like stretching, massage, or rest to prevent long-term muscle damage. For general discomfort, use baking soda sparingly for short-term relief from digestive or skin discomfort, but never as a replacement for proper medical treatment. Research insight. A 2020 study in the Journal of Clinical Endocrinology investigated the effects of chronic use of sodium bicarbonate on digestive issues. The study found that long-term reliance on baking soda can result in complications such as metabolic alkalosis, electrolyte imbalances, and worsening symptoms of underlying health conditions. 5. Consult a healthcare professional before regular use. One of the most critical steps in ensuring safe use of baking soda is consulting with a healthcare provider, especially if you have existing medical conditions such as kidney disease, hypertension, or heart disease. Sodium bicarbonate may interact with medications or exacerbate health conditions, so it's essential to get a professional opinion before incorporating it into your routine. Why consultation is important. Baking soda may interact with prescription medications, such as diuretics, corticosteroids, or blood pressure medications. In some cases, it may worsen conditions like kidney disease or heart failure. Consulting a healthcare provider ensures that you use baking soda safely, tailored to your individual health needs. How to consult a healthcare professional. For existing conditions, if you have kidney disease, high blood pressure, or heart disease, talk to your doctor before using baking soda regularly. Your doctor can provide alternative treatments or advise on safe usage. For safe use, if your doctor approves the use of baking soda, follow their recommendations regarding dosage, timing, and frequency. Regular medical check-ups can help monitor your health and prevent complications. Research insight. A 2018 study published in the Journal of Clinical Pharmacology found that sodium bicarbonate supplementation could interfere with certain medications, particularly diuretics and antihypertensive drugs, leading to serious health complications such as electrolyte imbalances and worsened kidney function. Always seek medical advice before adding baking soda to your regimen. These 5 expert-backed tips provide a comprehensive approach to using baking soda safely. By understanding the risks and following these guidelines, you can enjoy the benefits of this versatile ingredient without compromising your health.